Hello, my name is Lynette Stott. Starting off our day on March 1st, 2015, we went to the mall, we shopped, got our makeup done, and enjoyed a nice lunch. My cousin Tisha Perkins was 26 weeks pregnant with her second daughter in Joy Life. She was rushed to the hospital 7 hours later, not feeling well, and ready to meet her baby girl. Everyone was excited. Even though she was premature, it seemed like a long 6 months. The nurses were rude, and nothing she did made herself comfortable. She felt weird and very weak. The nurses insisted that it was the drugs, and the doctor refused to come see her. They didn't take her serious, and when it was almost too late, they finally took action. She and the baby's heart rate dropped, and at the moment when my cousin passed out, they finally took action. Still to this day, she sends me text messages of the pictures we took at the mall the last day of her pregnancy. Many people believe that hospital births are the safest way to deliver a baby, but you may be surprised to hear that there's other safer alternatives. Today, I'm going to be telling you some of the problems of hospital births and a solution you should consider home births. There are many problems associated with hospital births. Whenever you go to the hospital for giving birth, a sickness, or just to visit someone you can see that it's always busy. The doctors and nurses are always on the go. They have multiple patients, and they are not able to give you the one-on-one attention that you need. That being said, you are being rushed, and they give you medicine when you have pain to speed up the process. Your food and fluid intake is limited because if you have to have a C-section or any other emergencies, that may cause amnesia, according to Lynette Stott, an RN at a hospital. You don't have many choices when having a hospital birth. You are limited. You have limited people in the room. You have to take off all your jewelry. You wear an ugly gown, and especially at the birth, they put you on bed rest. According to Bonnie Richard, the planned home birth had fewer low tears and scars. They're not cutting you, they're letting you do it naturally. Yes, a hospital birth, you don't have to worry about cleaning up a big mess and gathering up supplies that the midwife needs, and more importantly, you're not comfortable or relaxed in a hospital. Now that we've discussed the problems of hospital births, let's talk about a solution, which is home birth. According to Patricia Hewitt, she wants more women to give birth at home, and it will outrage clinicians, but delight the natural birth lobby, who say the delivery of babies has shifted far in favor of medicalization. When you decide to have a home birth, you find a midwife which is registered and certified. A home birth costs nothing more than a bag of green garbage bags, a package of sterile, waterproof pads, and whatever else the midwife asks you to have on hand. On the other hand, if you want the complete course of care, including prenatal, labor and birth, and postpartum care up to 6 weeks, most of the midwives are going to charge about $2,500, according to Bonnie Richard. Home births put you in charge of your own pregnancy and labor and birth. Unlike the things I listed about the hospital birth, you can wear whatever makes you comfortable. You are not rushed. You have one-on-one care. You can have whoever you want there. You can make it public or private. You're not stuck in a room after birth. They do keep you on rest for a couple hours just to make sure everything's okay. And you're working with the same person that you started with since you found out you were pregnant. A lot of females, once they find out they're pregnant, they hire the midwife and they go to doctor's appointments with you. If you have problems, you can call them, and they're always on call. So say you go into labor and the doctor you've been working with is not available. They're not on call. So when you're going to labor, you're working with a doctor you're not familiar with. He doesn't know your complications, and you're not going to feel as comfortable or as you would with the midwife you've been working with. Of course, any form of birth methods will come with complications. Patricia McNeven, a 4-year Bachelor of Health Science Midwifery at McMaster University and a midwife for almost 20 years, says, the most common complications at birth are maternal bleeding and fetus distress, the baby having difficulty breathing, and we carry equipment to manage both of these problems. The other main safety consideration involves knowing when to move to the hospital if necessary. She says, we try to transfer to the hospital prior to the situation becoming an emergency. According to Sophie Goodchild, it is estimated that more than 200,000 women annually, a third of all who give birth every year, suffer from a psychological distress as a result of having a baby. That's why it is so important to be confident and comfortable with a good support system for your pregnancy and birth. In conclusion, remember my cousin Tisha Perkins that I talked about in the beginning? She was not comfortable or happy about her experience with a hospital birth. She not only lost her baby 13 days later after birth, she regrets going through with this form of birth method. The hospital stay was already a horrible experience, with nurses yelling, doctors refusing to treat her, and her voice not being heard. But having to bury her newborn baby was a traumatic experience. My cousin was 1 in 10,000 women that develop post-traumatic stress disorder, according to Dr. Bloat. Imagine you in her shoes. It is clear that home birth will give you the support and comfort you need. It is a hard thing debating if she went through with a home birth, would she still be holding her Princess Enjoy life in her arms today?